My name's Ian Ashman and I'm President of the Association of Colleges this year. And I've designated my year as President as the year of mental health in colleges. I want to see the year used to improve the support given to students and to challenge the stigma of mental ill health. Last year, the Association of Colleges ran a survey. And as a result of that survey, we found that 85% of college principals reported an increase in the number of students with mental health issues. And 2/3 of those talking to us said that those issues had increased significantly in the last couple of years. When we asked colleges what was driving that increase, they talked particularly about poverty and disadvantage. They talked about pressure of exams, and they talked about social media and the impact it has. So what we found is a significant increase in the number of students with mental health issues. But what we haven't seen is an increase in the level of service provided by mental health agencies to support our colleges. And that's why I'm calling for an increase in services. I've designated this year of my presidency as the year of mental health in colleges. And there are 3 things that I'm calling for during this year. I'm calling on government to make a step change in the way in which they support colleges. I'm asking them to work with the organisations that deliver mental health and those who support it to really think about how they engage with their colleges. Secondly, I'm asking them to engage with local health service providers. So those people in local areas who deliver mental health services to young people and adults. I'm asking them to think about engaging with their local college. And also I'm asking them to think about making sure that there's a further education representative on their local health and wellbeing board, those boards that plan services for local people. And finally, I'm asking that every college, principal and governing body, reviews the services and the support that they're providing to students with mental health needs. In order to make that review by commissioners and by colleges easier, the ASC is about to launch a second mental health survey, so we update our picture. And we're also going to be publishing some work that we're doing with the King's Fund and others to publicise good practice. And that good practice is going to include both examples where colleges are working well on mental health service issues, but also critically where colleges and the mental health service agencies are working well together to deliver improved services to students. Because at the moment we have a real postcode lottery. In some parts of the country there's excellent services to colleges. In others, people don't seem to know that their college exists. And yet the biggest number of young people with mental health difficulties, aged 16 to 18, will be in their local college. So if those are the clients that they're meant to be serving, then the thing they need to do is get to work with their college. So if we can do those 3 things, I think we can see a real step change in the level of support service provided to students, and we'll see a decline in the mental health challenge that our students face, as well as better services to them.